Alright, so welcome to another video. This is case number 3 of the ESSR quiz, and this is going to be quite a low value production. I'm getting lazy with all the editing. So we jump right into the case and I will show you my answer at the end. So when we look at this case, 57-year-old woman, degenerative knee pain, so there's nothing, really ordinary about the history, but when we can see this bone structure, the first thing we notice there is kind of like a coarse trabeculation, so the bone structure is not normal. We don't really see a nice corticomedullary differentiation in a way. You can see the striations all affect also the cortical bone. Then we have this sclerosis here, which we will come later to why that is, even here a little bit in the tibia. It doesn't really show so nicely on the x-ray here. So no effusion, we see patellar tendon, quadriceps tendon perfectly fine, Hoffa's fat pad is normal. So we don't see much here, no chondrocalcinosis. So there's no explanation why there should be knee pain, at least not from the bone perspective. I think the bone is kind of like an incidental thing, it's a generalized systemic thing. So let's go to the next image, not this one. So this is the continuation of the same case. Now when I looked at this image, I thought, okay, wait a minute, there is this dense area inside the head, and it's even here, so this looked a little bit like bone in a bone appearance. So that was the first thing that came to mind here, was seeing this thick cortical bone here, coarse trabeculation, bone in bone appearance. And then we have another image, which was the whole pelvis, and you can see this time we have the same bone-in-bone appearance on both sides. And this is kind of like giving us the idea, okay, we have a systemic problem. It's not just a singular bone, it's not some developmental thing. This is something systemic all over the body. We can even appreciate a little bit here that the end plates might be a bit more, but I didn't see that. I think they might have shown another image during the discussion, because I didn't have this impression of the rugged jersey spine which they came up with. We also have this sclerosis here, which also is part of this bone-in-bone appearance. And then within the greater trochanter, you can see there's another greater trochanter inside the greater trochanter. And so let me just see if I can pull this up. Okay, this is what I typed in, okay, bone-in-bone appearance. And bone-in-bone is just a descriptive term, and Radiopedia has a nice overview of what could potentially be the case. And by looking at this, or while investigating the case, it didn't really fit for me when I was looking at the case, because nothing was really, really matching. So we can see there's a lot of things, so we don't really have to go through all of that. So I think subcortical osteopenia, oxalosis, iatrogenic, this is probably not the case. Bone healing artifact, I don't think we have this. This obviously we would have to investigate how this looks like, but this was not the right answer. Disordered bone growth, well, potentially, so we have to keep that in mind. Abnormal bone metabolism, so this was something I was looking at, but it kind of like never really fitted very nicely. Patchet, it's not like so symmetric. Acromegaly, osteopetrosis, didn't really fit with the coarse trabeculation. So there was a lot of things, scurvy, and I was really going through some of these, but never really striking me as a very typical finding, and most of the time it was children or small children and not 57-year-old people. So I didn't really know what it was, to be honest, but what I wrote down, and I think that's a bit the funny bit, is I wrote down, you can see it here, I'm not sure if I can show you this in the camera, metabolic disorder, check the labs, or check the blood for whatever is going on, because I thought we didn't have the complete information at that time. And I think this was also, I'm not sure if I got the point, to be honest, but when we go to the solution of the case, let me just go here. This was the solution, case 3. Dense bone formed in pediatric skeleton. This is basically the bone-in-bone appearance. This was good for me because I didn't have this on top of my head, like bone-in-bone appearance, this happens during childhood, right? So resulting in bone-in-bone appearance, fluoride supplements as a child. So the patient had fluoride supplements as a child, and then this was the differential rugged jersey spine, although they didn't really show the spine to us. And this would be in hyperparathyroidism and renal osteodystrophy. But I didn't really find these things as part of the bone-in-bone appearance. Or at least not in the same degree like they showed us in the pelvis. And then fluoride ingestion, this was basically fluorosis. So this was obviously very rare and as a very interesting case. Okay, so that's it for this case, and now let's move on to the next one.